Hello, my name's Jacob. Today I'm going to be shooting my IV start video using my GPSPs. First thing I would do is knock on the door, open the door, walk into the room, shut the door behind me, identify myself to the patient. Hello, my name's Jacob. I'll be your nurse today. Then I would explain the procedure to the patient. I'm going to be doing a IV start on you. Is that okay? Once I get consent, yes, that's fine. I would then check to make sure that the patient doesn't have any allergies. The patient states that they have no known allergies. I would then proceed to get 2 patient identifiers. Those match, everything's good there. At this point, I could then perform hand hygiene. Get me a wipe to clean my workspace. Dispose of it. At this point, I can go ahead and pull over my IV solution and my tubing. I'm going to remove my tubing from the package, disposing of the package. I'm going to go ahead and open my IV solution and my tubing, making sure not to contaminate them. I will spike the bag, and I will hang the bag, filling the canister halfway. At this point, I can then take my tubing and uncap it and open up the tubing to get all the air bubbles out. Once all the air bubbles are out, I can then recap the tubing and then hang the tubing back up. At this point, I would then pull over my J-loop and my flush. I will pull out my J-loop. I'm going to go ahead and uncap the end. Go ahead and uncap my flush. I would then connect my flush and flush it. Setting all of that back down in the package. And setting that to the side. At this point, I would then perform hand hygiene. I'll pay for the vein that I'm going to use, and once I found the vein that I'm going to use, I would then pull over my IV start kit and my catheter, perform hand hygiene again, and don gloves. At this point, I would apply my tourniquet approximately 3 to 4 inches above my insertion site. I would then crack open my cleaning supplies and clean the arm. Disposing of it. Once that is air dried, I would then open my catheter, or I would then check for a radial pulse, then open up my catheter, stabilizing the vein by holding below, inserting at a 10 to 15 degree angle until I get flashback. And at that point, I would then drop down to skin level, advancing the catheter until it is seated properly. Making sure not to touch the insertion site. I would engage my safety, dispose of that in the sharps container. I would then take my J-loop and connect it. Still stabilizing. I would pop my tourniquet, pull back until blood flash, and then push for flush. At this point I can remove my flush. I'll get my techoderm out. I would open it and apply the techoderm. Once the techoderm is applied, I would then take my label, put today's date. Actually, first I would tear off a small piece of tape and secure my J-loop. Then I would take my label, put today's date, the size, the type, and my initials. I would then label my insertion site, and then I would proceed to clean up some of my mess. At this point, I'm going to change my gloves, perform hand hygiene. I would don new gloves. I'll take down my tubing. I would get an alcohol swab and I would clean the hub for approximately 30 seconds. Once the 30 seconds has passed, I would then uncap my IV, connect it, and I would set my drip rate to the appropriate drip rate. I would assess my IV site for any infiltration, and I would assess my patient for any adverse reactions, any discomfort, and then make sure that their call-out is within reach, report and record.